Hello, and thank you for choosing Community Health Network for your upcoming surgery. At Community, we're proud to offer an ERAS program for select surgeries. ERAS stands for Enhanced Recovery After Surgery, and it's important because it's a program specifically designed to reduce the amount of stress that surgery causes to your body so that your recovery is easier.
ERAS is used at leading health systems throughout the country and has shown that surgical patients following the program have fewer complications and improved surgical outcomes. We work together as a team, and you play an important role preparing your body for surgery, for your best outcome and recovery.
Your physician has selected you as a participant in the ERAS program. We're going to share some important information about how to prepare and what to expect. Also, feel free to share this video with your family and friends. They are an important part of your program and recovery.
Start getting ready for your surgery now with a healthy diet and regular exercise. If you already exercise, keep up the great work. If not, adding a brisk walk for 15 minutes each day will help you prepare and heal faster after surgery. If you're a smoker, try to stop smoking before surgery to reduce your risk for complications. This applies to e-cigarettes and vaporizers too. Quitting or reducing smoking just 2 weeks before surgery can make a big difference in your recovery.
If you drink alcohol, reduce the amount of alcohol you drink in the weeks or days before your surgery. Do not drink any alcohol 24 hours before your surgery, as this can interfere with the medications given to you at the hospital.
You should stop taking blood thinners a week before your procedure. This includes Advil, Aleve, ibuprofen, and Motrin. If you're on aspirin or prescription blood thinners, check with your doctor to see when you should stop taking those. Pregnant women who are taking a baby aspirin can continue the aspirin until the day before the scheduled C-section.
A member of the care team may call you the day before your surgery to go over final details and answer any questions. Although you cannot eat food after 10 p.m., you may drink water or clear liquids until 2 hours before your surgery. Please remember, if you eat or drink anything less than 2 hours before your surgery will be canceled.
If you were provided with a carbohydrate drink to consume before your scheduled surgery, please refer to the instructions provided by your physician regarding when to consume the drink.
On the day of your procedure, you'll check in at the surgery department or maternity services if you are pregnant. The preoperative nursing team will get you settled. You'll meet additional members of the care team, such as your physician and anesthesia provider, and have a chance to ask any additional questions.
Your healthcare team will treat you with medications in the preoperative area to help pain and nausea when your surgery is done. Depending on the type of surgery you are having, your anesthesia provider may discuss the option of having a nerve block. The nerve block can offer long-acting pain relief to the surgical area using a non-narcotic pain medicine. For many patients, this type of anesthesia offers pain relief without the unpleasant side effects and dependency potential of narcotic pain medications.
Part of ERAS is early movement after surgery, and a nurse will assist you in getting up and moving as appropriate. After surgery, you will be transported to a patient room. The nursing staff will continue to encourage you to move. You should expect to get out of bed and take frequent walks in the hall the day of surgery. We know that walking soon after surgery is very important for reducing your pain and speeding up your recovery.
Walking after surgery also decreases the chances of serious complications like infection and blood clots. Depending on the type of surgery you are having, you may be discharged home the same day. Some surgeries may require a longer hospital stay.
It's our goal to keep you comfortable by controlling your pain. However, it's not realistic for you to be completely pain-free after surgery. But you should be comfortable enough to move with assistance to a chair, walking in the room and halls, and walking to the bathroom.
Safety precautions will be in place to ensure you have assistance with ambulation to reduce risk of a fall.
An important part of ERAS that improves your chance of making a quick recovery from surgery is taking non-narcotic pain medications such as Tylenol and ibuprofen or Motrin to help control your pain.
These medications are safe, including for those patients who are breastfeeding, have been shown to be very effective in controlling pain after surgery, and most importantly can reduce your need for narcotic pain medicine. Your care team will provide you with instructions on how best to utilize one or both of these medications as you recover.
If your pain is severe, stronger pain medications will also be available. While narcotic pain medications can help control post-operative pain, they do come with risks like nausea, severe constipation, excessive sleepiness, falls, slowing of your breathing, overdose, dependency, or even death.
Dependency and addiction are low risk with short-term use of narcotics, but do come with a higher risk of long-term use over weeks and months. Therefore, it's our goal to prescribe you as few as possible for the shortest time possible, while keeping your pain well controlled.
After surgery, you can drink fluids and eat a regular meal when you're thirsty and hungry. The more you can do after your surgery, like walk, eat, drink, the faster your recovery will be, and the sooner you will go home.
Before leaving the hospital, you'll have the opportunity to meet with members of your care team to be sure you understand what medications to take and when. You'll receive discharge instructions which indicate how to follow up with your physician. In some cases, coordination of care with your primary care physician may be needed.
You may require a nap during the day shortly after surgery, but you should not stay in bed for long periods of time. Remember that moving will help decrease your pain and your risk of complications.
Your friends and family will play an important role in your recovery when you leave the hospital. While you may need some assistance with heavy lifting and some household chores, we expect them to help encourage you to stay active while at home.
At Community Health Network, we are your partner in a successful ERAS program and want to help you get back to your daily active life. If you have any questions, please ask a member of your healthcare team. We're always here to help guide you as you prepare for and recover from your surgery.